Hello all, today we are going to discuss about endoscopy. Endoscopy is a non-surgical procedure used to examine a person's digestive tract. Using an endoscope, a flexible tube with a light and camera attached to it, doctor can view pictures of digestive tract on a color TV monitor. Unlike many other medical imaging techniques, endoscopes are inserted directly into the organ. So principle, fiber optic endoscopes use bundle of thin glass fibers to transmit light to and from the organ being viewed. These fibers use the principle of total internal reflection to transmit almost 100% of light entering at one end to other end. Construction. An endoscope can consist of a ridged or flexible tube, a light delivery system to illuminate the organ or object under inspection. The light source is normally outside the body and the light is typically directed via an optical fiber system. A lens system transmitting the image from the objective lens to the viewer, typically a relay lens system in the case of ridged endoscopes, or a bundle of fibers optics in the case of the fiberscope. An eyepiece, modern instruments may be video scopes with no eyepiece. A camera transmits image to screen for image capture, an additional channel to allow entry of medical instruments or manipulators. Then endoscopic process. The endoscope also has a channel through which surgeons can manipulate tiny instruments such as forceps, surgical scissors, and suction devices. A variety of instruments can be fitted to the endoscope for different purposes. A surgeon introduces the endoscope into the body either through a body opening such as mouth or anus, or through small incision in the skin. Functions: view internal body parts using lighting system, camera, video, and use of medical instruments to remove unwanted cancers entered through opening in the body. Lasts 15 to 60 minutes. Limitations: compared with other parts of the digestive tract, the small intestine is difficult for doctors to access. While a camera-tipped tube slipped down the throat can get image of the stomach, and the tube inserted at the other end of the tract reveals the large intestine, no such device reaches into most of the small intestine. So doctors rely on externally generated images. Risks: the main risks are infection, over-sedation, perforation, or a tear of the stomach or esophagus lining, and bleeding. Although perforation generally requires surgery, certain cases may be treated with antibiotics and IV fluids. Occasionally, the site of the sedative injection may become inflamed and tender for a short time. This is usually not serious, and warm compresses for a few days are usually helpful. Medical uses: for investigation of the symptoms, nausea, vomiting, abdominal pain, difficulty swallowing, and gastrointestinal bleeding; confirmation of diagnosis, anemia, bleeding, inflammation, and cancer of the digestive system; and for giving treatment. Recent trends are endoscopy via stimulators, disposable endoscopy, capsule endoscopy, augmented reality. Future: video capsule endoscopy, suspected blood indicator, and quick view visual chromo endoscopy, 3D reconstruction software, remote manipulation. Conclusion: endoscopy made the minimally blood loss surgery with increased rate of healing and with less pain. Endoscopy done because of patient expectations and the gastroenterologist desires to provide the requested services the thoracic surgery to remove a tumor located in the thoracic cavity and able to thoroughly remove it by using an endoscope. Thank you.